But welcome everyone to Post-Op class. I'm Heidi, your dietitian. Today is going to be a quick half-hour class. We're just going to be talking through your diet progression. We'll also review the vitamin program. You will have a chance to be able to sample the vitamins and put together your order after class today. First and foremost, it's just important to remember your weapons that we've been going through at your initial nutrition visit and your Jumpstart class. These weapons really should serve as your daily checklist. They are going to be those habits and those guidelines that are going to help you to be able to optimize and maintain your weight loss. Today is the day. I know that you're probably anxious to be able to advance your diet. You will be seeing your surgeon, and if you're here and doing well, we should be able to move on to that next phase. But first and foremost, it's always important to remember to keep up with your hydration. Your hydration is building that solid foundation for success. It is what's helping with your healing process. So those fluids always come first. We're making sure we're getting towards that goal of 64 fluid ounces of those sugar-free, non-caffeinated, non-carbonated types of fluids. You want to keep any of those beverages less than 10 calories per 8 ounces. And as we start advancing the diet today, we also want to remember that we need to be separating those fluids from the meals. This means that you would try to stop drinking at your first bite. You're going to try to not drink with the meal as well as for an hour after. That feels better on your stomach. It's going to help you to be able to optimize your nutrition. It also is important for helping with portion control long term. Now, a couple things to remember, even as we begin to advance and we use protein shakes as a meal replacement, that protein shake would be like a meal. So the fluids that are in your shakes do not count towards your 64 fluid ounces. And also that shake is like a meal replacement. So you're trying to wait that 60 minutes after the meal before you resume drinking. Make sure that you keep up with your activity. We know your energy level maybe has dipped a little bit in these first couple weeks after the surgery, but you have to be using those muscles to keep them. We want you to be as active as you can. This helps to maintain your resting metabolic rate, which helps you to burn more calories at rest. It's also helping to maintain that muscle mass to minimize things like loose skin. But we have to include that daily purposeful movement, doing a combination of cardiovascular and resistance type of exercise, making sure you're using your upper body as well as lower body. Your goal is 30 minutes 5 times a week of a cardiovascular activity, 15 minutes 3 to 5 times a week of a strength training or resistance activity. So we want to work at breaking down those barriers. If you find that you're saying, I don't have enough time, it hurts before, during, or after I exercise, I don't know where to get started, then we need to be partnering with the physical therapy group so that they can help you put together these safe and effective programs. Those physical therapists are going to teach you how you're working smarter, not harder, pushing you into that fat burning potential. So if you haven't stopped by to visit with them yet, we would encourage that you do so even today before you leave the building. They would be happy to check your benefits. They'd be happy to talk to you about how they can help you to reach your goals. So as we begin to talk about advancing your diet, just remember that your stomach is a muscle and it is still healing. So we need to be gentle with that process. You are going to look at eating like an experiment. It's just kind of like starting to feed a new child. You want to start with one new food at a time. You'll gradually start combining those foods and gradually increase the consistencies as you know that your body is tolerating them. It's also important that we focus on this purposeful fasting. So even in these early phases, when you are filling up quickly, you're going to try to eat at least twice a day, but no more than 3 times a day. We want to develop of that purposeful fasting early on. Your process of eating is going to be just as important as your food choices in the tolerance of your diet as you're advancing. It's no joke that going out and getting your toddler silverware or those smaller spoons are going to be able to help with that diet progression. We're going to start, your bite should be no bigger than the size of a black bean or like the tip of your pinky nail. So using these smaller utensils is going to remind us to take those smaller bites. You're going to think about chewing that bite, swallowing, and pausing 1 to 4 minutes between each bite. I know that can feel like an eternity in the beginning, but between each bite, you want to stop and consider, how is this feeling on my stomach? Is it settling well? Am I to the point that I'm feeling satisfied? Because if you're eating quickly, even taking just a couple of extra bites can make you feel uncomfortably full. So we're focusing on that process of eating. Small bites, slowing down kind of with that process. Meals should take at least 15 minutes, but no longer than 30 minutes. So this also means we're not sipping on a protein shake all morning long, trying to get that protein in. You want to take as much of that protein shake as you can do, like in your 30-minute time period, but then you want to put that shake away. You have a chance at your next meal to go back and be able to emphasize that protein. But we're focusing on that purposeful fasting in between the meals to be able to promote that weight loss. What foods are you going to start with? First off, just remember that the stomach is a muscle and it's still healing right now. So we want to keep these consistencies soft and basically into these textures that would just run through a funnel to minimize how much that stomach muscle is having to contract. So starting with your protein shake could be a great idea because it's going to be full of nutrition. It's in that consistency that would go through the funnel. You can use any of those shakes that met the guidelines for your pre-op diet. If you had been using a powdered shake, you can continue to make that with like water, your unsweetened almond, cashew, or cocoa milk. Or you can begin using things like the HEB Mootopia or the Fairlife milk products. So we want to remember that regular milk, like skim, 1%, 2% milk, is high in a simple sugar called lactose. It makes it like a sugary beverage because it's higher sugar, higher carbohydrate. These products are unique because it's taking out that lactose, so it makes it lower sugar, lower carbohydrate, but it's also micro-infused with that extra protein. So it's giving you that higher protein, lower carbohydrate shift that we're looking for after the surgery. We just want to be cautious, even with these products. This is not something that we're just drinking with a meal because it can still be a liquid that can cause the stomach to empty faster. We're not drinking it in between meals because it has more than 10 calories per 8 ounces, so it can work to break that fast. And it's really not high enough in protein to be a meal replacement in and of itself. So that means we are using things like this to really just mix with the protein shakes or to use in cooking to try to bump up those protein levels. Yes?
So almond milk is okay?
Unsweetened almond milk is also okay to mix with your shakes. Yep, those are fine to use. And then beans are also another good option for this week. You can certainly boil and steam and mash your own beans, or you can use things like the fat-free canned beans. We just want to thin those beans out so they're more of the consistency that would go through the funnel. So you're going to want to mix these with water or with broth to give them that little bit thinner consistency. Because if you're eating them really thick like this at the beginning, what you might notice is you get kind of a cramping or wavy sensation after you've eaten something. That's your stomach muscle just saying, hey, I'm not ready to take on this work for you yet. And it's telling you to pare back on that consistency a little bit to help with that healing. Now, we do also live in South Texas with a lot of great beans, but I'll also caution you of going up to your local restaurant to buy those beans. Sometimes those are made with lard. That not only is going to increase the caloric intake, but the higher fat content of the beans that are made with the lard is also harder for the stomach to digest, and they may not feel as good on your stomach. So we want to choose those lower fat types of versions, okay? Eggs are another good option for this week. We get the protein from the egg white. It doesn't mean that you can't do the whole egg, but it does mean that we want to focus on the whites because that's where we're going to emphasize and get that protein from. I would suggest starting with really fluffy scrambled eggs, and we need to be consistent that we're almost like taking that egg and mashing it up really well on the plate and then taking our small bites. It's easy to make those scrambled eggs and think we're just gonna take a big bite like we normally would, and your stomach muscle might just be saying, hey, I don't wanna take on this work of breaking it down for you. So as you're doing those foods, we're really emphasizing that we're doing that digestion on your plate, in your mouth, to minimize how much that stomach muscle's having to work while it's healing. Low-fat dairy products can be another good option for this week. You can use things like low-fat cottage cheese. Ricotta cheese is another option that's a little bit higher in protein. For those that have maybe checked out the post-op meal plans on the diet nutrition section of the website, there's things for like the ricotta bakes that you can use for your diet progression this week. 2% cheese you can also use. A lot of patients like doing the part skim mozzarella string cheese sticks because it'll give you the feeling of doing something a little bit more solid. But as you're taking those small bites, it almost just dissolves in your mouth, and those are also well tolerated throughout this week. Greek yogurt is another good option. We want to choose the Greek yogurt because it's higher in protein. You're getting that 10 to 15 grams of protein in a Greek yogurt versus a regular yogurt's only going to have like 5 or 6. Now, I know it's confusing anymore when we go to the yogurt aisle, but any of like these Greek 80 to 100 calorie versions, even if it has the fruit in it, is typically going to stay within your guidelines. But if you're not sure and we're trying to select those, we're going to look at that nutrition facts panel. We're always trying to choose those foods and those meals that are higher protein, lower carbohydrate, or those numbers are hitting at least equal. We're trying to avoid those foods that are higher carbohydrate, lower protein, okay? So that means this week, even though it stays within our consistency guidelines, we wanna avoid things like cream soups, mashed potatoes, applesauce, oatmeal, cream of wheat. Those foods are the right consistency, but they're high carbohydrate, higher sugar, and they have very little protein. We want to be emphasizing that protein to help with your healing and to be able to optimize your weight loss and that metabolism. So if we choose any of those other foods, we need to add protein powder in it or something to make that macronutrient intake work for you, okay? Everybody's diet progression will go a little bit differently from here. One is going to be the volumes of foods that you might be able to consume. Some people are only going to be able to eat 1/4 of a cup before they feel satisfied. Others are going to be able to eat 1/2 of a cup. That is okay. That is still portion restriction. We want you to learn to eat to the point that you feel satisfied, as long as you're following our 3 golden rules, which is you're choosing protein foods first and emphasizing that at meal times. We're not eating more than 3 times a day, and we keep those meals less than 30 minutes. If you're following those guidelines, you should eat to the point that you feel satisfied at those meal times. Everybody is also going to advance their diet at a little bit different pace. Everybody heals just a little bit differently. On average, most people are going to need to stay on these stage 2, step 1 soft mushy proteins for about another 7 to 10 days. So that means maybe you go home today and you try beans. Tomorrow you're going to do some beans and eggs, or you're going to do your beans and cheese together. We just are going to start combining those. Once you know that you're comfortably tolerating these step 1 choices, then we can begin to advance to those step 2 choices. This means our stomach has had enough time that it's going through that healing process. It's ready to take on a little bit more work for you. It also means that we've trained ourselves where we're really focused on eating slowly, taking those smaller bites and chewing food really well. But we begin to add a little bit more consistency with the eggs. We start introducing tender types of meats, things like canned meat, tuna packed in water, fish, seafood. A lot of patients do well with like the really thin sliced deli meats. You can visualize it's going to be easy to take a small bite of this. It's going to be easy to chew it really well. Then you can start advancing into other tender type of cooking methods, using like a slow cooker or a pressure cooker, a braised. Again, it's going to make those meats so tender that it's really easy to take these small bites and it's easy to chew really well. Things like a dry baked chicken breast or a pork chop that takes a lot of chewing and a lot of work is also going to take more work on that stomach muscle while it's healing. Once you're tolerating these step 2 choices, we begin to advance into those stage 3 more solid types of foods. This is really the transition into the maintenance phase that you're going to be on the rest of your life. It's going to happen anywhere week 5 to week 8 after your procedure. We are always remembering the basics as we advance to that next level. We're always focusing on protein foods first. We're always being mindful of that process of eating, not eating more than 3 times a day and keeping those meals less than those 30 minutes while focusing on our sugar-free liquids in between. But this is when we begin to advance into those more solid textures. Now, it is important to begin to advance your diet, and that can seem weird to people at this point. Like, of course I'm going to advance my diet, but oftentimes patients can get comfortable in those soft, mushy proteins because maybe you know it feels good on your stomach, or maybe we're losing weight and we're afraid to mix anything up. But once that stomach muscle heals, those solid lean proteins and adding in your vegetables and not drinking with the meals puts more tension against the walls of the stomach to tell your brain that you're feeling full and satisfied on those smaller portions. What you may start finding is those soft, mushy proteins start becoming like slider foods. They'll start slipping through that anatomy more quickly. You need to start eating more before you start feeling satisfied. You start getting hungrier sooner. With those things start happening, we just have to remind ourselves that the consistency of those foods and the not drinking with the meals are an important component of making us feel full and satisfied with those fewer amount of calories. Once you meet your adequate protein needs, this is really just 2 to 3 ounces a day, or think the size of your first 2 to 3 fingers. Once we meet those adequate protein needs, we need to start adding in those non-starchy vegetables regularly, because your vegetables are where your fiber is going to come from, and that's also what's helping to balance out that caloric intake. Non-starchy vegetables are anything other than corn, peas, or potatoes. Now, you can use a few of these as your condiment to your meal even prior to this. So if you're doing really great with your eggs next week and you want to add in a couple pieces of onion or mushrooms or something in there for flavor, that's fine. But once we consistently meet those protein needs, that 2 to 3 ounces per meal, then we need to start adding in those veggies, because we're not just doing more and more protein, we're going to work our way around the plate where we're focusing on our 50% lean proteins, 30 to 50% non-starchy vegetables, but we are de-emphasizing that carbohydrate intake to 15% or less of the meal. We need to remember that de-emphasizing those carbohydrates is one of the things that turns off that hunger light switch. It's going to help us to control our hunger levels, control our cravings. It's also what's pushing the body into that fat burning zone and turning that generator on. So we're focusing on those proteins and veggies, de-emphasizing carbohydrates. Poorly tolerated foods the first 6 to 12 weeks. It's going to take about 3 to 4 weeks for your external incisions to heal. It takes like a full 6 to 12 weeks for the full internal healing process to take place. So we just need to be patient with that. During this time, we want to avoid super spicy things. Long term, there's no reason you can't do spicy other than you're just not drinking with your meal or an hour after. But it also doesn't mean your food has to be bland. You can add like a mild picante sauce or salt and pepper, different types of herbs and spices to make your foods enjoyable and flavorful for you. Be cautious of the overuse of really acidic things, particularly things like tomato juice and tomato soup. Those are really acidic to that stomach lining while it's healing. We also need to avoid those doughy carbohydrate-based foods. Not only do they fill your carb tank, but those foods also take on water or that fluid in your stomach and they swell, and they can make you feel pretty uncomfortable pretty quickly. You also have those sutures, incisions in your stomach that are healing over these first 6 to 12 weeks, so we want to avoid rough textures that can be irritating to those suture lines. So no coconut, no popcorn, no nuts, no seeds. can be irritating to that stomach lining. We're also avoiding caffeine the first 3 to 4 months. That caffeine is also irritating to the stomach lining. You can do decaf coffee, decaf tea, and those decaffeinated versions can count towards your fluids, but we do have to be cautious of what we're putting in it. We want to keep those beverages less than the 10 calories per 8 ounces. So that means we need to avoid like the high fat, high sugar liquid coffee creamers. You can use like a sugar substitute. You can use a splash of your Mootopia, things like the unsweetened almond or coconut milk, a splash of regular half and half. We want to avoid fat-free half and half because that's high in high fructose corn syrup, which actually makes it higher sugar, higher carbohydrate. So some of those products, and when we look at the labels, we do need to be cautious of, and we're trying to choose sugar-free like over the fat-free. But just be really cautious of what you're putting in those coffees. We're avoiding alcohol the first year. Alcohol can also delay healing in the early months. Many patients can't find they're sensitive enough to the sugars in alcohol that even 1 drink a week can be enough to slow or halt weight loss. So you do want to try to avoid it as much as you can in that active weight loss phase. There is also the increased absorption of alcohol. Drinking 1 drink is like drinking 4 drinks. So you do need to be cautious that you may feel the effects of alcohol differently. Make sure that you're drinking responsibly, drinking in moderation long term. We're avoiding carbonated beverages as much as possible. They can reduce the amount of restriction that you feel. And just a note on artificial sweeteners or sugar substitutes, these can be a good alternative to regular sugar, but particularly for those that are carbohydrate sensitive, where you crave those sweets or that doughy taste, although those foods do not contribute to your caloric intake, those artificial sweeteners and sugar substitutes can still trigger the pleasure and pain centers in our brain, which can increase that hunger or increase cravings for other sweet foods. So you still want to be cautious of how many of those artificial sweeteners you're using in a day. My recommendation is to try to stay below 4 like artificially sweetened products within like a 24-hour period. All right, so supplements after surgery. You will need to be taking your vitamin and mineral supplements ongoing the rest of your life, no matter how great you're feeling. We do know that there can be that increased risk of those micronutrient deficiencies. Part of it's the smaller quantity or variety of foods, but there is that change of anatomy that decreases the absorption of the nutrients that is ongoing. So it is important that we're protecting your health by having you be compliant with the supplement program, making sure that you're getting your vitamin profiles checked on a regular basis. We recommend those bariatric specific vitamins ongoing because your new anatomy is changing the way that you would absorb and utilize those nutrients. They are specifically created to give you the dosage of nutrients your anatomy needs, but it's also delivering the type of nutrient in a way that your anatomy can actually absorb and utilize. We do see improved nutritional profiles in people that stay on those bariatric specific vitamins. We do caution you of using those hard tablet vitamins. We can see deficiencies creep back in long term with the use of those. Being cautious of gummy types of vitamins. They tend to contain that lower quality, lower concentration of nutrients, which is why they taste good. We also recommend that you're cautious of those patch types of vitamins. We've seen some pretty severe nutritional deficiencies sneaking in with the use of those patch vitamins. So we do recommend that you're trying to stick to those things that we see help to maintain those vitamin profiles. So we're going to talk through the vitamins that we recommend here for you today. You will have, those that are here will have a chance to sample them and put together an order to take home. Long term, you do not need to have an appointment in our office. You can come into the window in the lobby anytime, Monday through Friday, 9 to 5 to purchase supplements. You can also order these off of the e-store, which is under the patient support tab on our website. Bariatric Advantage is the top company that we work with. They also have an automatic reorder program. So if you know that you don't live close to us and it's not going to be convenient to be coming back into the office, I do encourage that you consider signing up for this ongoing. There is no contracts for the automatic reorder, so that means you can cancel or change your orders at any time. What I recommend is that you save that Bariatric Advantage number in your phone so you always have it to contact them about changing your orders. The first time that you call them to set up for the automatic reorder program, they're going to ask you for a validation code. You can just tell them Sage Bariatric, or it's SBI for Sage Bariatric Institute. So we do want to consider those supplements as an investment in your new healthy lifestyle. I'm going to share with you a couple stories of why vitamins are so important. We had a patient 8 years out from surgery. She felt better than she'd ever felt in her whole life. So to her admission, she was using over-the-counter vitamins sporadically. She hadn't gone in for several years to get her vitamin levels checked. She ended up getting an acute illness like the flu and ended up with vitamin deficiency so severe that she ended up with neurological deficit to the point that she has to use a walker every day the rest of her life. At that point, those nutrient deficiencies are irreversible. I had another gentleman who was adamant about using his GNC vitamins that he always loved and worked great for him prior to the surgery. He wanted to grind those up and take them after his procedure. He came back to us about 6 months after his surgery. He was feeling very fatigued, could barely carry on his day-to-day functions, and had moderate amount of weight loss. Sure enough, as we checked his nutrient profiles, he had multiple nutritional deficiencies, even though he was taking his grinded GNC vitamins every day. He agreed to start on the bariatric specific vitamins at that time. At his 9-month checkup, he made a point to come find me because he finally felt like he thought that he had the energy that he thought he was going to have after the procedure. He was also losing weight at a degree that he felt happy with again. So your vitamins are a really important part of not only protecting your health, but protecting your metabolism long term. So we're going to talk through the vitamins that we recommend for you. If you can take a look at your vitamin order form, if you have these were on the table in the back here today, or they're going to be linked on the website. But there's a table, a slide that has 3 tables top to bottom. This is how we're going to look at selecting these vitamins today. Those that are here that need to get vitamins to take home, you're going to write your name in the top right-hand corner. You can certainly be filling these out, and then I'm going to help you with them at the end of class today. But the first thing that we're trying to select is your multivitamins. We have 2 main choices that we would recommend for you to take in these early phases after the procedure. The first is the Bariatric Advantage Ultra Multi-Formula with iron. This is the capsule version. It is going to contain all of your iron, your D, and your B12. The capsules are specifically made for bariatric surgery. They break open very quickly just with water and your own body temperature. One of the things to note with capsules is that if we do remember to take them one at a time, you want to take the capsule, then the water in your mouth, but try to swallow them a little bit with your chin tucked forward. It's going to help those capsules go down better. Our natural reaction with capsules is we like to go like this, but capsules kind of float and you have to drink more water. And if you're struggling with how much water you can get down at one time, you may feel like they kind of stick right here. They will not stick, I promise, because they're going to break open into that powder really quickly. But in order to minimize that feeling, try to get in that habit of just swallowing with your chin tucked forward a little bit. You're going to take 3 capsules per day of these. You would take 2 capsules before your breakfast and like 1 capsule before dinner, or 2 capsules with your lunch and 1 capsule with dinner. It is best to take these right before the start of a meal because it's not only going to help it settle better on your stomach, but it helps with the absorption of the nutrients when we take them close to food. Okay? There is a 30-day supply on the capsules. There's also a price break on a 90-day supply. The other option is the Advanced Multi-EA. This is the chewable version. You would do 1 chewable in the morning, 1 at night. It also includes all of your iron, your D, and your B12. There is a special technology in the chewables that helps with the absorption of fat-soluble vitamins. That can be particularly beneficial for those that have had the bypass. It's required for those that have done the duodenal switch. But if you are a sleeve patient and you prefer to do a chewable, it's fine to take these. The only contraindication is for those that are on a blood thinner like Coumadin, because it's higher in vitamin K. So you just need to let me know, and we'll talk about a different alternative if you prefer a chewable, okay? But those are gonna be the main options, choosing a capsule or a chewable. Vitamins are not gonna do any good sitting in your cupboard. You actually have to ingest them to get those nutrients. So you just want to pick the one that's going to work the best for you. If you can't stand tasting things, then you should go with the capsules. If you can't stand swallowing pills or have a hard time with that, then you should start with the chewables, even like your first few months. Okay. The next thing that we're deciding on is your calcium. Calcium needs to be a chewable, a liquid, or a powdered version of that calcium citrate. We're going to do 1,500 milligrams per day, split into 3 500 milligram dosages. And we're not taking that calcium within 2 hours of when you take the iron in your multivitamin. So I'm also going to provide the sample schedules for you today, and we will go through these as you select your supplements. But you're going to take that multi like with breakfast or lunch. You're going to take that the other dosage like with your dinner. And then you're going to do your calcium maybe 10 to in bedtime. But it is creating this new habit. So sometimes the reminders, like off of the Bariatric app, or setting your own reminders on your phone, or getting yourself a pill box or a pill container, it's going to help to trigger you to kind of create this new habit to take those supplements throughout the day. Now the calcium is going to come in a couple of different options for you. We have a hard chewable 500 milligram tablet. These you would take 3 times a day. They are a chewable. They have a little bit drier consistency, but you don't need to stop drinking. You can drink your fluids at the same time that you're taking your calcium. So that is fine to do. 1 bottle is going to be enough for like a 30 days, and it comes in a wild cherry, a chocolate, or a cinnamon. We also have the 500 milligram soft chewy bites here in the office. These are also 3 times a day. 1 bag is enough for 30 days, and it comes in a strawberry, orange, lemon, caramel, chocolate, coconut, or a chocolate peanut butter. So you can mix and match those calciums kind of long term, so you don't get taste fatigue, but you can always just start off with the ones that you like the best, okay? There are also liquid and powdered version calciums available, so if you really have an aversion to taste or to chewing, those can also be an option for you, okay? The next thing that we're going to talk about is just the supportive nutrients. Those are going to be listed in the bottom table. The first is the probiotics. Probiotics are a natural, healthy bacteria that lives within your digestive tract. It can help with healthy digestion, healthy immune function. Studies are showing the use of probiotics after bariatric surgery can help to improve vitamin profiles. It also can help patients lose a statistically greater percentage of weight. We do carry a variety of probiotics here in the office that you're going to see on that list. One is going to be a chewable probiotic. That's just a lower dosage. You can take 1 or 2 per day. The Balance is a capsule that's equivalent to those chewables. We also carry the Endimune. The Endimune is a high potency, broad spectrum probiotic. I highly encourage that for people that have history of digestive issues, things like constipation, diarrhea, IBS. We're also seeing benefit of the Endimune for some people that have a lot of sugary types of cravings. Sometimes that can be an imbalance of that bacteria within the digestive tract, and the use of the Endimune can help to kind of balance that out. We also carry the Thorn Prime and the Bariatric Advantage Control. These supplements are unique in that they don't help as much with your digestion, but they have a specific strains of bacteria in there that help with breaking down abdominal adipose tissue or belly fat. So it helps to reduce that waist circumference, which that is a hard area to mobilize regardless sometimes of the weight loss. So it helps to reduce that waist circumference. You can use a combination of the probiotics. So if you're really interested in that one, but you also have digestive issues, you can do 1 in the morning and 1 at night. The Mariva, this is a curcumin-based product. It is a safe plant-based anti-inflammatory. So for those that had maybe used a lot of those non-steroidal anti-inflammatory medications that we're trying to avoid because of that irritation to the stomach lining, the Mariva can be a safe alternative for things like joint pain, fibromyalgia type of pain. It's just not an acute product. You're not going to take it once and notice a big difference. It's something that you kind of need to be consistent with taking. Doing high dose of omega-3 fatty acids can also be helpful. Those omega-3 fatty acids in more than 1,000 milligrams, those help to get in your essential fatty acids. Those are important for healthy hair, skin, and nails, as well as those omega-3 fatty acids work to act as a detoxifier in the body. Doing the amino complex, this is a pre-digested protein powder. It helps you to get in those essential amino acids, but it is a unique product because it is pre-digested. It does not contribute to your caloric intake. So it is a way that we could add in those essential amino acids in between the meals to mix with your water. That can help to maintain muscle mass. It's also another factor that's important for healthy hair, skin, and nails. And biotin is another collagen that's important for healthy hair, skin, and nails. So some are concerned with hair loss after bariatric surgery. We can't predict the hair that was in the resting phase at the time of your procedure last week. We also can't predict which individuals would deem surgery and weight loss as a stressful event, where that hair could start shedding 2 to 6 weeks or 2 to 6 months from now. It is a temporary hair loss, but the use of the biotin, if you'd been using that prior to the surgery, we can add that back in at this point. We are also finding the use of those high-dose omega-3 fatty acids in the amino complex helps to kind of get your nutrition up off of the floor a little bit more quickly, sometimes can help to minimize that stress on the body to try to minimize that hair loss down the road. What I just want you to realize with hair loss is that once the hair starts shedding, there's nothing that we can do to stop it because your body's going to be responding to something that's happened in the past. All we can do is promote hair regrowth, but we can try to be proactive to try to minimize that risk for you. Just remember your supportive resources. Try to attend support group. Make sure you're utilizing that Bariatric app for tracking your intakes. Make sure you're looking at that diet nutrition section on the website. If you want that specific meal plan with recipes for your diet progression, it's going to be available for you there, as well as different recipes and meal plans, nutritional resources long term. You're welcome to take advantage of the Bariatric Counseling Center that's also on the 3rd floor of our building. This is a group program. It helps to work on your relationships with food, emotional eating. You get to spend time in the kitchen preparing meals with their dietitian and learning those different skills. It is like a post-surgical rehab. So if you haven't stopped by to visit with them, we would also encourage you to do so, having them check your benefits and how they can be helpful for you. Remember, do not be panicked if you hit a stall in your weight over the next few weeks. We expect that weight loss is going to look like a staircase. It is also common that some people will hit that 3-week stall anywhere from 2 to 6 weeks after their surgery that can last as long as 2 weeks. Just make sure that you're focusing on non-scale victories. Focus on taking your measurements and photo journals. Focus on your diet progression. Realize that when we stand on the scale, that's not just measuring fat loss, it's measuring all kinds of changes in your body composition. So don't let that mentally kind of discourage you. Just stick with the process and I promise things will work itself out. Remember your critical symptoms after the surgery. If you do spike a fever, have persistent abdominal pain, nausea, vomiting, issues with the incisions, it's still important that you call the office and discuss those with us. You still can be at risk for blood clots for several weeks after the procedure, so if you do experience chest pain or shortness of breath, it is important to call 911 or go directly to the nearest emergency room. But from here, we're just going to remember our weapons. We're going to focus on hydration and then our protein. We'll advance the diet as tolerated, just being mindful of that process of eating slowly, taking small bites, chewing those foods really well. Remember, I'm always available for you if you need to schedule an appointment to talk through things one-on-one. Congratulations. All right, so any questions as a group about diet progression or vitamins?
All right, and then 2 hours later, my stomach was growling.
Growling again. Yeah, so the growling thing, I mean, there is a certain time when it is important to advance your diet. Sometimes as the stomach's healing, the stomach acids are a little bit different in what's happening in there, so that can feel like it's hunger. And there's like this, what's head hunger? You might hear all these rumbling noises, which are really just part of the healing process. So it's hard to kind of understand with that, what is true hunger versus what is just kind of, does that feeling kind of satiate for a short period of time once we eat something that we have to be cautious of. So, you know, we can talk about that as you begin to advance the diet, talking to your surgeon about it and seeing. Now, some people will have true hunger, and we do need to advance the diet, and if that's, you know, resolved by that, that's okay. But also there can be all this healing that takes place, and there's just, your stomach's gonna sound different, it feels different, and just because we hear those sounds or different things may not be that that's always what would be an indicator for hunger.
Keep drinking water or?
Keep focusing on your fluids, sometimes using like that sugar-free Jell-O or the broth or different things kind of in between as much as you can in between those meals, because we want to create that fasting period. And so again, it's this mindset of, am I really, okay, this might be hungry or this might be how I feel it, but it's also changing this mindset of hunger isn't always a bad thing. It means your body's turning that generator on and it's pushing your body into fat burning. So we also have to really kind of look and say, you know, have I had a good meal in the not so distant past? Am I going to be able to have something again soon? Can I use those fluids to try to push into that next meal? Because sometimes it just takes a while. As your blood sugars are regulating and you're getting used to things, it takes a while for that hunger to begin to regulate. And sometimes we just have to develop those new habits first and change mindset.